are some encouraging signs emerging from the latest COVID-19 numbers. Dr. Jennifer Kwan has been closely tracking these numbers every single day. She joins us again from Burlington. Doctor, how encouraged are you by the numbers? And I appreciate we cannot put aside what's happening in long-term care homes because it's devastating. But in the public generally, what are the numbers telling you?
So right now, the long-term care homes are definitely in a major crisis right now. However, we do have some reassuring overall signs for Ontario. So one of the encouraging signs is that the total number of active cases in Ontario has decreased today for the second day in a row.
What's encouraging about that?
So basically, we are looking at the new number of infection cases per day and comparing it to the total number of resolved and diseased cases in a day. So when you have fewer new infection cases but more resolved and hopefully less deceased, that indicates that we may be reaching the peak or decreasing the peak in the number of total cases in Ontario. And that's what everyone's looking for, right? Waiting for the peak and to flatten the curve and to go on a downwards trend.
The decline that everybody is hoping gets here sooner rather than later. Let's have a look at some of the charts. We've been following them every single day. This is COVID-19 hospitalizations, ICU, and ventilations. I've been watching closely those dark red numbers hover around 200, but not going up. Those are the ICU and ventilated patients. What does that tell us?
So it has been reassuring that looking at the numbers, we have not overwhelmed the ICU capacity in Ontario. So we have not reached a scenario, for example, in Italy, where people have been turned away due to lack of ventilatory capacity in hospitals. However, our hospitalization numbers are still going up, so we do still have to understand we're not out of the woods yet and be very, very cautious because, you know, even though it's kind of relatively flat for the ICU numbers right now, it hasn't really gone down, as you said.
And very quickly, we should remind people, as the medical officers of health have been reminding people, that when these numbers go down, that is not the end of it, it's the first chapter. And what should people prepare for?
So I know everyone is very anxious and hoping the economy and everything will reopen. I think we have to be very, very careful because everything we've done so far and everyone's, you know, doing such a great job staying at home. But we can't just open up all at once. It has to be very gradual, following on public health recommendations. Because if we open up all at once, it will all be in vain. We will not have flattened the curve. We would only have delayed the onset of the curve. So we need to make sure that we're following social distancing guidance still.
Dr. Jennifer Kwan, thank you again.
Thank you.
All right.